Hello guys, welcome back to my YouTube channel. Today's the topic of discussion is cardiovascular system. From now onwards we will be discussing one case per day of cardiovascular system, and starting from now. So today's is a 50-year-old man had an MI and was taken to the hospital. During his admission, he developed symptoms of left ventricular systolic dysfunction. Now, list two symptoms of left ventricular systolic dysfunction. Now, first of all, in every scenario, you have to focus on the age of the patient. This is very important, and it give hints about all the details, or you can rule out the causes of any infection or any other disease. So if there is an aged man, you will think in a different way. If it's a young man, young age, you will think different diagnosis. So 50-year-old man had an MI and was taken to the hospital. Now there is another important thing that is not mentioned in this scenario is time. Exactly by which time after the MI he was taken to the hospital. So treatment includes according to this, and there are certain complications of MI that are important according to the time duration. So in the first 3 hours there is different complications. After 24 hours there are different complications. For example, I would mention that the very first symptom that the very first sign of myocardial infarction that appears is left ventricular systolic function. So they have probably mentioned it that way. Alright, and after 24 hours or 1 to 3 days there occurs uremia, uremic encephalopathy, or there may be Dressler syndrome, that is another disease. So not getting into the detail, let's just quickly review into this. List two symptoms of left ventricular systolic function. Now for this I have shown you this flow. This is a very important pathway, and in a simpler way I have explained it. From the deoxygenated blood, so it's a deoxygenated blood that travels from body, enters into the right atrium. From right atrium it travels to the right ventricle, then to lungs to oxygenate for oxygenation, through pulmonary arteries, and then from pulmonary veins to left atrium, and then left atrium to left ventricle, and then to body for systemic circulation. Alright, so what happens in left atrium is what is the problem there? Left ventricle is out of function, it's not working properly. So the blood can't go it can't cross away from the left ventricle, so it start backing up backwards. Alright, so what is affected at the first place? That is left atrium. So what happens in left atrium? That increases in size. So if we ask that what are the two symptoms of left ventricular dysfunction, that is left atrial enlargement. So what would be and then it also increases in size, and also blood starts backing up from left atrium, from then to pulmonary veins to lungs. So you would feel shortness of breath. So the two symptoms would be shortness of breath, one, and exertional dyspnea. Whenever you would try to take few steps, you will feel tired and you will face shortness of breath. What other symptom can be done? As the blood is pooling up in the lungs and you can't breathe, so usually due to gravity, after standing position, all the fluid is at the base. It comes, whatever fluid has entered in the lungs, it will reside at the base. But once you are in a lying position, suppose at night, you will face shortness of breath. Alright, because no gravity is working at there and heart and lungs are at the same level, so you will feel paroxysmal nocturnal dyspnea. Alright, so this is the one symptom. So this is paroxysmal nocturnal dyspnea. Nocturnal means night, dyspnea means difficulty in breathing, and paroxysmal is something that comes and goes, not permanent. Alright, now coming to the next question of the scenario. Enlist name 4 chest x-ray findings that you would expect to see in left ventricular dysfunction. So I would also attach the picture of x-ray of left ventricular heart failure, but reading what happens in a chest x-ray finding of a left ventricular heart failure is alveolar edema. First thing, there are the lungs as tissues, and there are alveoli surrounding the tissues surrounding the parenchyma is called as interstitium, and there are alveoli, so fluid will enter both the interstitium and both the alveoli. If it is entering the alveoli, because of this you are feeling difficulty in breathing, so it will be called as bat's wing appearance. Alright, I will attach the picture so it will be very clear to you, but the terminology in medical term is bat's wing appearance because it looks like the wings of the bat. Alveoli, all alveolar filled with the fluid, alveoli filled with fluid will take the appearance of bat's wing. And there is interstitial edema as well, that will be termed as Curley B lines. Alright, they will be like horizontal lines coming at the costophrenic angle, so they will be termed as Curley B lines. And what else is cardiomegaly? Obviously left atrium was increasing in size and blood was pooling up in the blood was pooling backwards in the lungs, so there will be cardiomegaly. The fourth part is catheterization of vessels. What is catheterization of vessels? Is actually usually in the normal condition during standing, or in a normal condition due to gravity, the lower lobes are filled. If there is slight water or anything, the first part to be filled is lower lobe, but in fluid overload there is already lower lobe filled, and it will migrate the fluid towards the upper lobe. So this is called as catheterization. Is actually what is the word catheterization means? Towards the head. Catheli means head, and catheterization of vessel. So fluid will be transported from, due to pressure, increase in pressure, lower lobe is already filled, and despite the gravity effect, it will flow towards the upper lobe due to fluid overload in the lungs. So there will be upper lobe congestion, so this will lead to catheterization of vessels.